My name is Howard Tobin, and I've been practicing cosmetic surgery for 50-some years now. I started out with the intention of becoming a head and neck cancer surgeon, and actually started doing that. I did fellowship training in cancer surgery after I got out of the Air Force. And as a result of the reconstructive work that I was doing, I started doing some cosmetic procedures, but the turning point in my career was actually in about 1980, I would say, when I was invited to go on a teaching mission in China that was sponsored by the American Academy of Facial Plastic and Reconstructive Surgery. Dick Webster was on that trip, along with a surgeon by the name of Bogus, who was a very prominent facial plastic surgeon. I got to know both of them very well on that trip. And quite honestly, I, like many others, fell under the spell of Dick Webster, who encouraged me to think about cosmetic surgery as a career. Well, as it happened, that was just about the time that liposuction surgery was sort of taking hold. And we were talking about that while we were in China, actually. And I said to Dick, that sounds like a bunch of nonsense to me. And he looked at me with kind of a stern look, and he said, Howard, he said, that's no Bogus, and you'd better learn it. As it turned out, shortly after I got back, I saw a notice that Jules Newman was putting on a course in liposuction in California at the Century Plaza Hotel. My mom lived in Beverly Hills. Of course, I live in Texas, but my mom lived in Beverly Hills, so I went out to the meeting, and of course I was staying with my mom. So I went to the first day of the course, and I got back, and my mom said, Howard, what did you think of that? And I said, well, I don't know. Second day she asked me, I said, yeah, it's really interesting. And by the third day, I was kind of hooked. So one of the speakers at the course was a fellow by the name of Gary Fenno. I knew Gary somewhat. He practiced in Houston. He had come down from Alaska. So I knew him slightly, well enough that I went up to him and I said, Gary, I'm kind of interested in learning about this liposuction. Would you mind if I came down and watched you? Which was really the beginning of a lifelong, wonderful friendship. We became very close friends. For many years, we would put on courses together and sort of spearheaded the Cosmetic Surgical Society of Texas. At any rate, I got involved with the Academy, and very shortly after beginning my involvement, I was given the assignment of heading up the fellowship program, which was in its infancy. I think when I started, I know Bob Alexander, Dr. Bob Alexander had a fellowship, and I think that's about all there were. So I kind of think mine was the second fellowship that we started, and then at that point I started training fellows. And of course it was a new experience to me. I wasn't really a teacher by nature. I was a practitioner, but I got to love it. I learned by teaching my fellows, and I've been very, very fortunate in having several of my fellows who have come to take on leadership positions in the Academy. So it's been a very, very rewarding thing to me. You were asking me about the importance of fellowship training, and it's vitally important. I was probably the last generation that could learn by the school of hard knocks. You just can't do that anymore. I gave a talk earlier today at the Academy, and I was talking about a procedure that I do and how I learned by traveling first to California, then to London, then to Denmark to watch people do it. And that's the way we learned. We had no other way of learning because we didn't get that type of formal training in our residency program. Well, now we have fellowship training programs, and a young doctor that wants to go into cosmetic surgery is obviously almost required to take a fellowship training program. You just can't go out and bulldoze your way through like we did. We were renegades, there's no question about it. But now good training is available. The Academy has a bunch of great training programs, and I think it's just a wonderful opportunity for young doctors that want to go in the field. My advice to any doctor is do what you love, whether it's cosmetic surgery or dermatology or physical medicine. I think you've got to find what you have a passion for. Because I don't think that you're going to enjoy doing what I've done, and that's practicing for over 50 years in a specialty, if you don't really enjoy it. Because I'm long past the point where I need the money. I'm quite well off. So you have to have a passion. You have to be doing what you love. And that's something that each individual has to find within themselves. As far as the training, I mean, you're not talking about very much. It's one additional year of training beyond your normal formal training. Now, any medical training is long and it's somewhat arduous. It's not like it used to be in the old days, believe me. Young doctors are on time schedules and they have time off. And I mean, these are concepts that we never dreamed of. I mean, when we were residents, it was 24 hours a day, 7 days a week. So I don't think that you're asking too much of a doctor. After all, medicine is about the only career I know where if you get through the training, you're guaranteed to do well. So it's not a question of making a living, it's a question of finding what you have a passion for, something that'll stimulate you for the rest of your life. And if it's cosmetic surgery, go for it. My legacy, I guess my fellows that I've trained, I suppose. I take a great deal of pride in them. I'm always pleased to see them and proud of their accomplishments, and they're always an ego boost to me because they tend to be quite flattering, which I probably don't deserve, but I think that's my legacy, really, and my patients. I've made a lot of patients happy. I've made a change in life for a lot of people, and of course my Ruth, too. That's part of my legacy. She's been a wonderful part of my life, so I didn't want to do anything except get in trouble, which I did plenty of. I think I told you before, it happens to be true. I was kicked out of every school I went to until I got into medical school. I graduated from Princeton cum laude on probation. At the time of my graduation, I was on disciplinary probation, academic probation, and chapel probation. I was on triple probation and I graduated. So I was kicked out of high school. I was even kicked out of grammar school for smoking. So, you know, I just, I don't know. I don't know what, I had a wonderful, wonderful family. How they put up with me, I don't know. But my dad kept encouraging me to be a doctor. He was a pharmacist, and he said, "Oh, the doctors make all the money." And so I didn't even want to go to college. I actually wanted to be a naval aviator, but there was no possibility because of my vision. So obviously, my other life is a pilot, and so I've achieved that as well. But that's what I really wanted to be. So my dad pushed me into medical school. I got into medical school. I loved it. I absolutely loved it, and I've loved medicine every day since.